and that is why it is so important to add faith or cultural factors into the arena. And all the clients that come to Sakoon, that is what benefits them more so than just the conventional techniques.
So you've given an example of obsessive compulsive disorder. Again, many families watching this program will have some real experience of depression, anxiety, all sorts of issues out there. What kind of things can you offer in terms of comfort from the Quran or the Sunnah for them? You know, as we're sitting here today, obviously it's not an individual prescription that you're giving, but the kind of things that you found helpful.
There's so many, and it varies between various issues. So I can give you a few examples, just a brief summary, so it doesn't reveal the client's identity. I've had a client that was sexually abused as a child, and she disclosed this for the very first time after 30 years. And the main reason that she did this was because of the culture, you know, that she would be shunned upon, that if she talked about it, it would be seen that it was her fault. And she had to keep this pain and this emotion with her for 30 years. And it was the very first time that she had the opportunity to talk about it. And a lot of intergenerational issues were involved as well, about talking about there was a lack of support in her time when she was a child, that there wasn't any services that they are right now compared to now. So there was a lot. So
what specifically from the Islamic point of view were you able to bring in to help her? Because presumably that feeling of shame or blaming yourself or not wanting to talk about it because you would be actually accused of being the problem.
So that was one aspect. One was the cultural aspect. So it was about distinguishing the difference between culture and religion, so that there are negative aspects to culture, but there's also positive aspects towards culture. That was her experience. In regards to Islam, we looked at what the role of a man is and what the role of a woman is. What are the etiquettes that a man has towards a woman, and vice versa, and to you know, emphasize upon the fact that abuse is wrong, it is haram, it's not allowed in Islam. And this was something that she didn't know. She'd
actually thought that this was something that was justified.
Because yes, she did, because she was a child, and this is the way that she's been brought up. She had no one to turn to. Everyone said that she would be deemed as the person that, you know, it's her fault, this is her, she created it. There was all these different thought patterns that were going on in her mind. So it was important to educate her. And also, you know, this created a number of other issues that came into her life, such as identity issues, femininity issues. She felt that she couldn't be feminine. So from an Islamic perspective, spirituality was very important for her. So we looked at the role of a woman. So we looked at, you know, the wives of the prophets. How did they live their lives? And you know, these are very strong female role models. And as she looked at it, she realized so many different things that she never knew before. So for example, her definition of femininity was you can only be naked. And that's for a woman to be feminine. She didn't realize that you can actually also cover up and you can be feminine as well. So we looked at that, we explored that, and you know, there was a number of other things that we did in the sessions to help her. So it was a lot of different thought patterns that she had that wasn't logical, and she could see that, but she just needed obviously an arena to be able to talk about that and feel understood, because a lot of cultural and religious elements influenced her problems, and she wanted someone that could understand that.
So of course that kind of experience would go across all communities, because abuse is present in every community, but the people who undergo it feel that there is this unique experience, and culture, faith, as well as the wider issues get intermingled. I mean, has this been your experience?
That is my experience, and I think, you know, for women it's such a huge issue, because there is this whole thing about being unclean and whether you're going to be a suitable wife, whether you're going to be a suitable mother. So all of those things come into play, and I think one of the things that we do need to look at as well is how we deliver services. I worked in a day service where we had an Asian women's service, and what was really interesting and what I learned from that was that after the Asian woman who ran that service left, we had an increase in the number of South Asian women that came, and they said it's because we're not sure that it will stay confidential. And that was a learning curve for me.
Because sometimes being part of a community means it's small, everybody knows each other, so you don't want to go and unburden
That's right. So sometimes when services look at culture, they get it wrong. And the other thing that comes up quite often is that whilst it's important to look at culture and faith, sometimes that can make other things be overlooked. So it's getting the balance right.
And I completely agree, because when I actually started off in this arena, the first thing people used to always ask is this confidential? Will my uncle find out? Will my parents find out? We get clients that have perhaps, you know, forced marriages or secret relationships. And, you know, the emotional impact that this has on, you know, young people, as well as the parents, as, you know. But that was emphasised, that this is a confidential service and we are here to try to help you through your concerns.
Coming on to the wider issue of lots of different minority communities experiencing this, sometimes there's a danger ethnic minority communities start competing with each other. It's as if, well, so-and-so is getting it or we're not getting it, rather than everybody working towards making sure everybody gets their needs met. Do you feel there may be a danger with that within the psychological therapies as well?
I think I have to say that my experience in terms of mental health is that isn't the case, because access can be so difficult for all those minority communities. And if you even look at gypsy traveller communities, people don't see them as a minority community, but of course they are. So access to services are so difficult. So I don't think you have the same level of that competing for things. I do think that there is a danger sometimes that professionals, almost without knowing, use culture and religion as an excuse not to deliver a service. So the whole kind of they look after their own.
And there's that aspect as well.
Comes in a lot and is relevant to a lot of minority communities. Well, yes, we may look after our own, but we still need the support to do that.
So sometimes it's false praise almost.
Yes, absolutely.
But they take care of the old people, they take care of the vulnerable. They don't need.
We don't need to think about the culture and stuff, because they look after their own. And you know, and then obviously the assumptions. I was reading a case study today about someone who fed curry when he was really unwell, and he was just like, actually, I don't eat curry, and I've got physical illnesses, which means I really shouldn't eat them, but because I'm Muslim, they gave me curry. So there's a lot of education, but I do think that there is so much out there. There is a wealth of experience out there, and actually what government ministers, what practitioners need to do is to tap into the expertise that exists within our communities.
And what's so important is that all agencies work together to help improve the mental health services, to include all these other factors and influences that's missing, that's not actually helping the actual patients, the clients that need it.
Well, in all of this complexity, what are you going to be saying next week when you're part of this panel advising the government on commissioning? Because it seems you've got a handle on what's going on.
Yeah, I think the important thing really is to recognise service user involvement, so to actually talk to the service users about what's been difficult for them, what's worked, what hasn't worked. Because if we don't, unfortunately, the new strategy, No Health Without Mental Health, isn't as strong on service user involvement as New Horizons was. So one of the things that we want to focus on is getting back the service user involvement issue. But also I think that community assets has to be put on the agenda, because you know, we're out there, we have the experience, and we can support the government. If we all work together, we can really make a difference.
And there's going to be this Islamic psychology conference coming up. What are the details of that?
Yes, there's a Islamic psychology conference coming up in London on the 27th of July, and the 28th of July it will be based in Manchester.
So the same thing will be repeated in Manchester on the 28th,
it will.
Starting in London on the 27th.
Yeah.
And is it only psychologists and mental health workers who can go to this Islamic psychology conference?
It's for anybody that has an interest in Islamic psychology, that wants to learn more about it. A lot of professionals will be there, as well as people that just want to have an interest. I will be a keynote speaker there for Sakoon Counseling Services, and I'll be talking about the Islamic counselling just kind of illustrating Islamic counselling and what it's all about.